Hear me, Mr. Chairman?
I can hear you, Councilman Bochop. Good afternoon.
Excellent. Good afternoon.
Well, greetings, everybody. We're waiting for our council to connect. We are going to do an announcement to inform our community of of the timeline of this COVID-19 response and just get some information to our general counsel on how it played out. So we have Councilman Bochop is connected, and the treasurer, Patrick DePoe, is connected as well. And we should be getting the vice chairman and Councilman Itis connected soon. How you doing, Mr. Treasurer?
How's it going?
Going good. Going good. All right.
Am I on there?
So Vice Chairman, we hear you. Councilman Itis?
Am I on video or no?
No video. Just got your audio.
Oh, no.
Yes, sir.
All right. Well, we have our full council here, so let's get started. So what we wanted to do, this is a message for the Makah community.
Can you no?
Oh. Councilman Itis, yeah, we see you.
Okay.
All right, you ready? We're ready.
Okay, ready.
Here we go. All right, so this message is for the Makah community. This is the Makah Tribal Council. I'm TJ Green, Chairman. I'm joined with Vice Chairman Keith Johnson Sr., Treasurer Patrick DePoe, Councilman John Itis Sr., and Councilman George Chad Bochop. And we wanted to get some information out to the community to let the community know how we got to this point, some of the things that were happening and going on over the last couple of months that lead us to where we are today. So we felt that information was important for the people to know. So what I'm going to do is I'm going to share a document. I'm going to share my screen and put this document up on for people to see. And what we have here is the Makah Tribe COVID-19 pandemic response timeline. And so if we just take a look at this, and we'll just kind of scroll through it as we go. On January 29th, the Makah Tribal Council was first informed of the first COVID-19 virus case in the United States by Sophie Tredevick Indian Health Center Director Dr. Elizabeth Cope. Then on February 13th, the Makah Tribal Council was informed that the U.S. has 12 cases and Washington State has 1 case. On February 27th, the Makah Tribal Council was informed of the first community spread of COVID-19 occurring in California, and we began preparing pandemic household kits and supplies, and that was done down at the Sophie Tredevick Indian Health Center. February 28th, the Makah Tribe's Sophie Tredevick Indian Health Center activates a level 2 EOC response to prepare our tribal healthcare facilities for the emerging worldwide COVID-19 pandemic and informs the Makah Tribal Council of the necessary action. A day later, there's information out on February 29th of a first recorded death in the States, and worldwide there are nearly 87,000 cases. So that was the first month. All that happened in the first month of our notice of COVID-19. On March 2nd, the Makah Tribal Council officially declares a state of emergency by resolution and places the Makah EOC on standby to prepare for COVID-19 pandemic response. On March 3rd, Sophie Tredovic Indian Health Center delivers COVID-19 educational materials to the Senior Center and hygiene kits delivered to the Nibe High School Lady Reds for the state basketball tournament. At this time worldwide, there's approximately 90,000 cases and 3,000 deaths. On March 5th, we had the first tribal leaders call with the White House and Health and Human Services and IHS personnel, as well as Department of Interior officials regarding COVID-19. On March 6th, we received our first tests at Sophie Tredovic Indian Health Center, and limited testing becomes available. On March 12th, the Makah EOC is activated to support community preparations for COVID-19 pandemic response. At this point, Washington State has 568 confirmed cases. On March 13th, Makah Tribal Council passes proclamation of emergency, the Makah Tribe Emergency Management Operations Resolution number 2020-01, to strengthen our COVID-19 pandemic response. Also on March 13th, the Makah Tribal Council meets with small business owners involved in the hospitality and food service industry and fishermen, including fish buyers, to inform of upcoming restrictions and address concerns. A day later, on March 14th, the Makah Tribal Council informs Governor Inslee's office of upcoming actions regarding the hospitality and food service industries in Nia Bay and closures of the reservation to non-residents, including recreational fishermen and charters. On March 16th, the Cape Flattery School District closes K through 12 schools in Nia Bay and Clallam Bay through April 24th by order of Washington State Governor Jay Inslee. On March 16th, the Makah tribe closes the reservation to all non-residents, including all lodging facilities, publicly or privately owned, all trails, beach access, and boat launch facilities. Additionally, the Makah tribe closed the Makah Cultural Research Center, Youth Center, Community Gym, Fitness Center, Community Hall, Senior Center, Marina, Head Start, Early Head Start, and child care facilities. All food service facilities were restricted to delivery or takeout only. On March 18th, the first confirmed COVID-19 case in Clallam County was reported. Our community was advised to stay home and not travel outside of the reservation. On March 20th, the Makah tribe issued a shelter-in-place order, and Dr. Cope was appointed as the health officer. At this time, there were 25,522 confirmed cases in the United States, and Washington State had 1,793 confirmed cases, and Clallam County had 2 confirmed cases. On March 26th, Washington State numbers rose to 3,207 cases, 147 deaths, and Clallam County had 5 confirmed cases. On March 26th, Nia Bay has 0 confirmed cases. We have a total of 10 tests out. 6 are negative and 4 are pending. It's important to note, our healthcare officials let us know that both Clallam County, within Clallam County, it's difficult to get tested. They have some of the strictest testing rules in the state right now. That's due to supply. There's not a great supply of testing that the healthcare facilities have. And so there's some strict guidelines put on it. And that's also the case in Niamey. So that's the reason for the low number of tests in that report. On March 29th, that's today, there's over 135,874 confirmed cases and 2,389 deaths in the United States. Washington State currently has 4,310 confirmed cases and 109 deaths. And what's important about that is that this is what's going on, in our state, in our county. These are the risks that are out there, and these are the reasons that the tribe is asking you to stay home, stay safe, to shelter in place, and to stay within your own family unit. So, the threat is not gone. It is still out there. Cases are still increasing off of the Makah reservation, and the amount of people that are dying from this is increasing as well. So we want to keep an eye on that and make sure that we're aware of those things and not fall into an area where we become comfortable or complacent about what's happening just because we're not seeing it directly yet. So we want you to be aware of that. But with with those things that we did put in place, we want to thank the community. We want to thank the Makah community for their tremendous efforts to social distance and shelter in place. Please continue to stay home, stay safe. Let's all stay the course and even do better. Continue to refine your basic essential needs for your household. Forego nutritional items that are not necessary. Shop locally at Washburns. As of yesterday, there was adequate supply of hygiene items, meats, produce, medicines, and diapers. The shelter-in-place order is in effect until April 24th, 2020, and may be rescinded or lengthened in accordance with public health risks to the community. The Makah Tribal Council thanks our entire community for their efforts and all our tribal employees, Cape Flattery School District employees, Washburn staff, Makah Mini Mart staff, public safety staff, first responders, our fishermen, seniors program staff, Makah Head Start staff, the water, sewer, sanitation department staff, Sophie Tredovic Indian Health Center staff, and information technology staff for providing essential services to our community during this crisis. We also thank our local churches for cooperating with the Makah Tribal Council and providing services to those in need. We also appreciate the work and support of our United States Coast Guard and families at the Coast Guard Station Niamey. With that, I'm going to wrap up this message and just tell everyone that we'll continue to provide updates throughout the week and get you more information about what the government is doing to keep you safe, and then also to provide you services and also help providing relief during this economic hardship that we're all facing. We're working on those things, and there'll be more information coming this week. All right, everyone, take care. Sure.
Sure.
Everyone away.